Hi, I'm Alba, and I am from Morris and Sussex Children's Mobile Response and Stabilization Services, and that is through the Center for Family Services. I am one of our crisis intervention specialists and also our community engagement and resource development specialist. Um, I've been working here about 2 years, and so I'm really excited to tell you guys about what we do. So here's just a quick run through of what we're going to cover today. I have a small icebreaker for us to do. Then I'll talk about my agency, Center for Family Services, the children's system of care, what mobile response is, how we can help, how to get services, when to get services, and some things to consider before our time for questions. So first, just a quick icebreaker. So what you can do is scan this QR code or go to menti.com and type in that code down there. And you'll be prompted to, you can give one response, two responses, or three responses. But our question for today is, what helps you during a crisis or a difficult time? We'll give you guys a couple minutes to answer. To go. Let me stop sharing that one and I'll share our other. Okay. So here we can see like kind of all of our answers. Um the words that are bigger are ones that more people are answering. So we have some of the big ones, some breathing, right? I love that. I'm always talking about box breathing, family and friends, so those people that we can really count on. And then we have some of our like other coping skills, listening to music, exercising, taking time for yourself. These are all really important coping skills. And usually for mobile response, it's something that we talk about a lot. When we're in a crisis or having a difficult time, we're trying to identify what can maybe help. Go back to our other one. Thank you. So then I'm going to talk about my agency, Center for Family Services. We are a nonprofit here in New Jersey, and Center for Family Services is statewide. Here in this circle, you'll see some of our areas of service, so community connections, counseling and behavioral health, workforce development, addiction and recovery. Because we are statewide, we have even offices all the way down in South Jersey. The county kind of determines like what services are available. We don't have all these services available in every county, but here in Morris and Sussex, we offer outpatient therapy for adults, children, couples. We also have psychiatric evaluations and medication monitoring with an APN. We have our Family Crisis Intervention Unit, FCIU, Kaleidoscope, which is a support group for teens and young adults in the LGBTQ plus community. We also have Family Outreach Program and our Family Stabilization Program. Some of these are covered by Medicaid, some are free to the community, and some are referral based. If you are seeing any of these and you are wanting more information, I'll share my email at the end and you can reach out to me and I can connect you with someone who works specifically for that program and will be able to help. So next is our child system of care. It's also called CSOC. So CSOC is New Jersey's behavioral health care system for youth up to age 21. And it is part of the Department of Children and Families. And one important thing to know is that child system of care is administered, so the administrative body for them is Perform Care. So when you want to get services from the child system of care, you're going to call Perform Care or go to Perform Care's website. So those terms kind of become interchangeable. When you're going to hear people talk about it, like, oh, you're from Perform Care, they mean the child system of care. We use them very interchangeably. And so in this circle here, you can kind of see the large umbrella is Department for Children and Families. And then we have our bubble of CSOC/Perform Care. In there, you can see Mobile Response, MRSS. So that's us and what we'll be discussing today. But Perform Care and Child System of Care has a wide range of services and other programs like CMO and FSO. And in DCF, there is also the Department of Child Protection and Permanency, so DCPMP. It used to be called DIFUS, so just child protection. We are separate from them. We're still all under, Department of Children and Families, but we are separate. We work closely with them a lot. They refer to us. We are all mandated reporters, so we, have to call them sometimes. And we have a collaborative relationship, but it's just important to know, just because you're in one doesn't necessarily mean that you're involved with the other. So what is mobile? So Children's Mobile Response and Stabilization Services, excuse me. So I am going to call it mobile. That is like the easiest way. It's called Mobile Response, MRSS, CRMSS, but it's an 8-week program for kids and families. We are serving youth up to age 21, so they can be 20, and they're experiencing behavioral or mental health crises. What we do is crisis stabilization, case management, and link to therapeutic services. Our services are 24/7, so we always have someone on call, weekends, weeknights, holidays, every day of the year, every time. We have at least one crisis intervention specialist on call. And also we have a supervisor on call as well, who is a licensed clinician. Our services are also available in all languages. We have access to a language line so that we can serve all families. And I'll get into kind of like what our team looks like who's on our team, but we have Spanish speaking staff. And so for families that aren't English or Spanish speaking, we do use that language line. We've had families who speak Mandarin, Ukrainian, Arabic. So these services are possible for all of those families. An interesting part of our mobile response in Morrison, Sussex is that in Sussex County, our mobile response and our family crisis intervention unit are combined. So just for Sussex County. For Morris, FCIU is a separate program, still with Center for Family Services. But in Sussex, our FCIU program is for youth ages 11 to 17 that are engaging in high-risk behavior. So things that are unsafe, running away, substance use, or truancy. And FCIU specifically can facilitate court involvement or placement outside of the home. However, those are not the first options. That's never what we want to go to first. And so what I always say is, if you feel that, you have a child who qualifies for FCIU, you can call mobile and get mobile response services, and your a crisis intervention specialist, your case manager, can help determine what programs are appropriate at that time. So what does our team look like? Our team, we have our director, and then we have 4 program coordinators. They're all on our like supervisor level. They are licensed clinicians. We have one of them on call 24/7. So again, weeknights, holidays, weekends. And then right now we are fully staffed at 21 crisis intervention specialists. These are our case managers. These are the people who are going into the homes, doing the weekly follow-up calls. Right now we have 8 of them who speak Spanish, which is great. And then we have 3 interns that I supervise. We take interns on every school year, so they are a really big part of our team, and they help support us. And we now have 1 intake specialist who does the majority of our intake calls and some billing things for us. So our team is always expanding, which is great, and we're able to help more families. So how we can help. The first thing that we do is called an initial dispatch. This is the first meeting with you, your child, and the case manager. It's in person, so it can be in your home, it can be in the community. I've gone to dispatches that are at parks, at the library, really wherever you feel comfortable meeting. If someone is sick or there's other reasons why we can't be in person, telehealth is also an option. Our dispatches are meant to be immediate, so from the time that you get connected with us on the phone, we try to be to you within an hour. If that time range doesn't work for you, that is all right. We can schedule you for the rest of that day or the next day, right? If you call at 9 a.m., you might be at work, your child might be at school, so you can schedule for later that day. An initial dispatch is usually between an hour and 2 hours. It definitely depends on all of the things going on, how much you want to share. And what we do is crisis stabilization. So making sure that everyone is, has calmed down. We talk about the issue at hand, like really what's going on. And then we safety plan for, those safety concerns. One call that we get a lot is for any like suicidal thoughts. And what we'll do with the child or the youth and their caregiver is plan on how to make the environment more safe, right? So is there a friend we can call to talk about it? Is there someone we can talk to just for a distraction? Do we have any of those coping skills that we talked about before, right? Any family, any friends? Does maybe going on a run help? Does box breathing help? And our case managers can also kind of demo some of those things if they haven't been put in place or if they're unfamiliar with any of those. We also, again, safety planning, so making sure the environment is safe, right? Taking out any sharp objects, monitoring all the medications in the house, so we just know what the safety concerns are, and making sure that someone's checking in to make sure no sharp objects are missing, no medications missing, and that everyone is safe. The next thing that we do is put in therapeutic services. We look to put in an in-home therapist for 8 weeks. They are called intensive in communities. So we call them IICs a lot. That's an acronym that you're going to see a lot. So the IIC is a licensed clinician. They can meet, in the home, in the community, the library is a very popular spot. Or they can do telehealth as well. We also put in behavioral assistants, which are, bachelor's level professionals who work with the IIC put in place. And behavioral assistants or BAs really work on specific behaviors. So they might put in a reward chart or help someone practice their coping skills, that those breathing techniques or grounding techniques. They might help a youth, make a schedule and practice sticking to it. Another person or provider that we can put in place are called parent coaches, which is essentially an IIC for the parents. So they really focus on, explaining different parenting styles, explaining where maybe your parenting style came from, and supporting you in supporting your child. The other part of mobile that the CIS will do is the case management. So they're doing weekly follow-up calls with the family to see if there's any change in behavior, change in, feelings, any progress we're making. They're also going to call any providers that they put in place to see, their input. And then they can connect with other providers as well. If you are, getting medication from the pediatrician, we'll have you sign a release if you want us to be able to talk to the pediatrician, school staffs, or right, like the school social worker, the guidance counselor, really anyone who interacts with your child, and you want us to collaborate with, we are definitely open to doing that. Another part of it is linked to resources. So it's simple things sometimes, even like giving them information on a jewelry making class, because this youth really likes jewelry making and is in need of developing good hobbies, or a place to make friends. Sometimes it looks like, signing the kid up for soccer team. We're also connecting people to resources if they're having issues with basic needs, so like paying for their mortgage, paying for food. The case manager can find some other resources that maybe can help. We also do mid-visits and termination visits. So, right, we have that initial dispatch at the beginning, and then halfway through or at the end, we might have another visit to talk about the progress made, and what would help going forward. Which brings us kind of to our transition planning. So transition planning is really important because our program is only 8 weeks. So we really only have 8 weeks of service for our case managers. Sometimes, they have the IIC for 8 weeks and, everyone's feeling really great. And we love to see it. And so then we'll just close out at the end of those 8 weeks. If, maybe there's still some progress to make, we can put in a 4-week extension with any of the providers we put in. So the IIC, the BA, and the parent coach can see the family for another 4 weeks. And then their case manager will give them some resources for continued care after that, right? So whether it's outpatient, if it's with Center for Family Services or somewhere else. And then, so that is kind of like one option, continuing services at a less intense, maybe once a week, maybe once every other week, kind of frequency. Or if the therapist comes to us and tells us like behaviors have increased, there's, more issues in functioning, we can refer to a higher level of care, or maybe some other programs. So insurance. It's good to know that our program is free for all families. Every single family, regardless of income, regardless of immigration status, it is free for all families. We bill through Medicaid. And for families that don't have Medicaid, we collect dates of birth, social security numbers, employment, and income information for the entire household. This lets us bill to Medicaid, so that there's going to be no charge to the family, there's no charge to their insurance, the family doesn't have to be eligible for Medicaid or have Medicaid at that time. So it is very, very sensitive information, and we understand that. So all of this information is protected and used in a HIPAA compliant manner. It's just important to know that to get services covered, you will have to give this information, and we'll need it within 72 hours of meeting with you initially. So how to get services? As I said before, you're going to have to call Perform Care. That's their number right there. Perform Care, again, because it's New Jersey's child system of care, it's statewide. So what they do is they do an intake and then they triage. So they're going to ask you questions, what's your address, what's the date of birth, all of these things. Then they're going to call someone at Mobile Response. Sometimes it's a CIS answering, sometimes it's our intake specialist. And we do our own intake just so someone has a clear idea of what's going on before they go into your home. And some of these questions are safety, and we ask everyone them. So like, any weapons in the home, any animals in the home, like anything that we should know before we walk in. So once you're connected with mobile, if you want immediate, that's the time. We got an hour to get there, or you can schedule for later that day. It's important to know that we do up to 21. So for kids that are 17 and younger, a legal guardian needs to call for them. The school staff can't call. School staff can help a caregiver, a legal guardian, help them call. But the legal guardian must be on the phone. Once they're 18, so that 18 to 20 range, they can call for themselves and get services put in place. The phone call, I would give yourself about 40 minutes, just because you have to do that intake and triage with Perform Care, and then an intake with us as well. So it's not a super quick phone call, so I would just give yourself some time. Right, and then when to get services. So for Mobile Response, there is really any time that you're having a difficult time, it's a crisis to you, that's a time you can call Mobile Response. So I did section off some examples. So mental health issues like depression, anxiety and panic attacks, substance use, suicidal thoughts, pretty much anything in that realm is when you would need to talk to a therapist. Behavioral concerns like aggressive behavior, breaking things, hitting others, school refusal, and just general oppositional behavior. So really struggling with not listening, to the point where it's, we're not functioning in the day. Trauma is another one. So loss of a loved one, DCP&P involvement, or domestic violence. We also serve youth with intellectual and developmental disorders. And our case managers will be able to help the family get more services tailored to that specifically. So some things to consider, if we're thinking about calling Mobile Response, is that our crisis intervention specialists, our CIS, are bachelor's level. They are not licensed clinicians. So the person that will be coming to your home in an hour is not the therapist. They're just the case manager. They are very well trained. They just aren't going to be doing therapy, within an hour of when you called us. They're also unable to restrain or transport youth. So if a youth is like being aggressive, we're not able to, stop them from hitting other people. We're also not able to drive them anywhere. If they're refusing to go to school, we can't drive them to school. We also don't provide school clearance. So we are bachelor's level professionals. So we can help determine whether someone, maybe needs to go to the hospital and get a screening, or, that would be a call that we make to our on-call supervisor, who is a licensed clinician. And then it's also important to know that our program is only 8 weeks. We're going to help with that transition plan, but once you call mobile, the work isn't done. We are going to need continued collaboration and effort from families in order to get them set up with something that is more long-term, so that they can make the progress they're hoping to make. All right. Thank you for listening. That is my email there. So you can email me if you have any questions, concerns, or if you're looking to, get more information, or, more information about any of the programs that I talked about. Thanks.